Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast.
Welcome back, listeners, to the Med Edit Podcast. I'm your host, Dr. Cari Sorrell, here with my co-host, Dr. Jessica Gray, for another great episode bringing you medical facts without misinformation.
We have been waiting so long to finally do this episode. In fact, this specific topic is the reason we were inspired to start a podcast fighting back against misinformation on social media and online.
Not only do we finally get to address the all-encompassing topic of hormones, but we have one of the leading experts in the region joining us today to separate fact from fiction.
In studio today, we have Dr. Shaili Felton, board-certified endocrinologist, aka a real hormone expert. To say that we are excited would be an understatement. This episode is sure to be one of the most controversial and popular.
And in our second segment today, we play a little game that we made up called Fact or Misinformation.
I love it. We have props today.
Props. With social media clips from Instagram and TikTok. Stitch incoming. Is that what the kids say these days, I think?
I don't know. I had to look that up. So sit back, relax, and get ready to talk about thyroid and all things hormones.
It has become an increasingly more popular discussion on social media. Hormone management, hormone regulation. We've all heard hormone balancing. There's an endless recommendation list from medical influencers, most of them peddling usually some sort of product for purchase, touting a cure-all with their therapies and recommendations. Now, I know as I'm saying these words, our guest in the studio is probably cringing right now. Dr. Shaili Felton, we are thrilled to have you here with us today. And before we dive in, I actually want to spend a few extra minutes focusing on what makes you an expert in the field of hormones. So many people online and even in person claim to be, quote, hormone experts. This includes people without any medical training at all, and even some nurses and some doctors. The level of training, education, and certification you have makes you unique and definitely not a dime a dozen like some of the influencers we've seen on social media.
So for background, we will focus on this for a quick minute. Dr. Shaili Felton is a graduate of Texas Tech School of Medicine and completed her residency in internal medicine and fellowship in endocrinology, diabetes, and metabolism at Barnes-Jewish Hospital, Washington University in St. Louis, Missouri. Since moving back to Lubbock in 2010, she was initially part of Covenant Medical Group, and then she recently joined faculty at Texas Tech University Health Sciences Center, where she serves as an associate professor in the Division of Internal Medicine. Currently, she has a very, very busy general endocrinology practice at the new UMC Health and Wellness Hospital. She is board certified by the American Board of Internal Medicine in both internal medicine and endocrinology, so double board certification. Dr. Felton is passionate about practicing general endocrinology with a focus on managing and treating conditions such as diabetes, thyroid disorders, and diseases of the adrenal and pituitary glands. She's also played a pivotal role in establishing and managing a multidisciplinary osteoporosis clinic at the Texas Tech Health Sciences Center with the goal of integrating diverse medical expertise to provide comprehensive care and improve patient outcomes. Lots and lots and lots of education there. Lots and lots of amazing things. She's actually even been named Texas's monthly superstar doctors list, received a top 20 under 40 award, and she's been honored with multiple awards through multiple organizations throughout the West Texas region. So, Dr. Felton, thank you so much for joining us today. We are honored to have you here.
Thank you so much for having me. Wow, that sounded really impressive.
You are impressive. It deserves the recognition, especially when we're trying to talk about who tells you about your hormones. Where do you get your hormone information from?
Absolutely. No, I was excited to be asked to be on the podcast today to talk about this very topic.
Wonderful. We're super excited to have you. And let's start by talking thyroid. So the poor little thyroid gets blamed for a lot, doesn't it? Since it does have an effect on the body in so many ways, often it's one of the first things checked with common complaints such as fatigue, weight gain, and constipation, of course. But most often it's not the culprit. Dr. Felton, let's go all the way back to the basics. What is the thyroid? What is the purpose of this small but very important organ in our body?
So the thyroid is a butterfly-shaped gland that sits kind of right here at the base of our neck, and it produces thyroid hormone. And you're right, the thyroid is really blamed for a lot, but the best way to think about it is that you have to have the right amount of thyroid hormone for all of the cells in our body to function optimally. But it's very rarely the magic bullet. Really, I just think of it more of like we need to have appropriate thyroid hormone levels in order to have a level playing field for everything else to work the way that it needs to.
Absolutely. I mean, there's been several times, I'll be honest, anytime I gain weight or I get tired, I'm like, it's probably my thyroid. We should check that.
Yeah.
Like, I'm always hoping that's the answer.
For sure.
And it never is.
It's an easy thing.
In our family medicine clinic, that is what we see all day, every day. I now know just add it in so that we can know that's not it. So we can move past that conversation and keep going. But sometimes there are problems with the thyroid. And that's when these big questions do come up. How do we treat it? What's going on? So tell us a little bit more about what are some disorders of the thyroid?
So when we think about the thyroid, I try to break it up into two sort of categories. So we need to think about the function of the gland and then the structure of the gland. So what you both are referring to right now when we talk about these symptoms that come up, in our daily conversations in clinic is really referring to functional abnormalities of the thyroid gland. So like we talked about, the thyroid produces thyroid hormone. So if there are not appropriate levels of thyroid hormone being produced, then that can obviously lead to issues. So when we have an underactive thyroid or have too little thyroid hormone, that's known as hypothyroidism, with Hashimoto's being the most common cause. And if we have too much thyroid hormone production or an overactive thyroid, then that's known as hyperthyroidism. We can also have structural abnormalities of the thyroid gland, thyroid nodules, thyroid cancer, just to name a couple. I do want to point out that you can have structural abnormalities of the thyroid gland and the function of the thyroid still be completely normal.
That's a good point. That's a really good point. One of the most frustrating things patients ask about when we talk about the thyroid, especially in my clinic, is why didn't you order a full thyroid hormone panel on me? Why are you only looking at one or two of the thyroid function labs? So it is so frustrating to me to try to explain, how the thyroid is not an independent little organ, how it has a relationship with the brain and the rest of the body. And there's a biofeedback mechanism. And so one lab does not equal the other one, and they're not all weighted the same. So can you break it down for us a little bit? So if we have, say, a patient, or even if you are a medical provider and you're talking about thyroid hormone labs, how do you know which ones to be looking at?
So, the TSH is the most sensitive marker of thyroid function, and TSH stands for thyroid stimulating hormone. So when we are talking about primary hypo or hyperthyroidism, the vast majority of the information that we're going to need is going to be told by the TSH. Now, if the TSH comes back abnormal, I will often do a T4 and a T3 level to help better delineate that TSH abnormality and kind of provide us guidance accordingly. If I find that a patient has hypothyroidism or an underactive thyroid, usually at least once I will check an anti-thyroid peroxidase antibody, which is just looking as Hashimoto's as the etiology, for their underactive thyroid. But this is certainly not a lab that needs to be checked over and over and over again. So it's either positive or it's negative. For patients that are hyperthyroid or have an overactive thyroid, I will check a thyroid stimulating immunoglobulin or a TSH receptor antibody to look to see if they have Graves' disease or an autoimmune reason for their hyperthyroidism. I think some popular labs, especially sort of on social media platforms, when we talk about these full thyroid panels, et cetera, that get a lot of weight and that we don't typically clinically use in practice, is a T3 uptake. This used to be helpful when we did not have good free T4 lab assays. So the T3 uptake does give us an indirect measure of thyroid binding globulin, and we need to know what these levels are when we're interpreting total T4 and total T3 values, but really don't have much clinical relevance anymore at all because we do have a good free T4 assay, at our disposal. And then another one that comes up a good amount is the reverse T3. This is an inactive metabolite of T4. It's widely measured by alternative health practitioners to justify the use of T3 therapy and supplements thought to enhance the conversion of T4 to T3. It is extremely limited utility for conventional medical practitioners like us. Really, the only time that I consider checking this test is to help distinguish central hypothyroidism, which is kind of above and beyond the context of this podcast, or patients that have non-thyroidal illness, and these are patients that are critically ill. So I really want the take home here to be is that you can see, right, that we really need to individualize what labs that we're doing based on that patient's history And it certainly is not cost effective, nor does it really change our clinical management to do this quote unquote full thyroid panel on every single person that walks in the door.
I think one of the things that my patients get the most frustrated about is that we oftentimes will order a TSH initially. Like you said, TSH is the best test that we have. It's the most sensitive marker for detecting an abnormality in the thyroid. And then it's normal. And then they say,
yes,
well, you didn't check the rest of them. So what do you say to a patient who says that?
So, and I think you probably have to deal with this probably more in the primary care space than we do, as an endocrinologist, when typically they already have somewhat of a diagnosis before they come and see me. And I will be honest, a lot of times, in order to sort of set people's minds at ease, I will often do a T4 along with the TSH, so that they have confidence that we have looked at the thyroid in sort of a more complete fashion. But again, certainly there's no indication to do all of the antibody testing and the reverse T3 and the T3 uptake. And I think that's sort of what's being touted as a full thyroid panel, again, on these social media platforms.
Yeah, at least for me, being a gastroenterologist, I've been caught a few times in this because, when people come with constipation, if I don't have a cause, I'll check their thyroid hormone and doing my due diligence, doing my job. And then it comes back abnormal. And I'm like, well, time to send you to see somebody else because now I don't know what to do for you. But you're welcome. Diagnosed you. That's usually my experience with thyroid in clinic. But
that's actually probably the more satisfying ones, right? Because then you have something to pinpoint and you can, we can do something about that.
Yeah.
So.
The hardest is when, like you said, they're already established and they're like, well, we should check my thyroid levels. So I was like, I'm not the person to check your thyroid levels because I don't know how to change your medications based on that. But we can absolutely get you to see somebody who can, for sure.
Absolutely.
So let's say we have a patient who comes in and they've been experiencing some symptoms of, fatigue, inability to lose weight, hair thinning, which could be me, and their thyroid labs are normal, which is also me. What in your mind are other culprits to these symptoms?
So this is probably the hardest conversation that I have on the daily, is when I see patients that have all of these symptoms and they're real symptoms. So, I don't want to invalidate that, but they're convinced it's their thyroid labs come back normal. So the conversation that I have, because, the symptoms of hypothyroidism specifically, which is what you're describing, are very non-specific. And there are certainly many other medical conditions that can, mimic those same symptoms. So we need to think about untreated obstructive sleep apnea, iron deficiency anemia can cause a lot of that symptomatology. For women, the perimenopausal, menopausal symptoms can often mimic that as well, just to name a few.
So that's really helpful. And that's oftentimes, even in my own primary care practice, I try to break that down. And like you said, the biggest thing is most people who get told it's not their thyroid and they come in convinced that it is, they don't feel like they're being heard. So oftentimes, just advice to other medical practitioners who are listening to this is just acknowledge those symptoms and acknowledge that what they're feeling is real. So we need to say, what else could be going on? And like you said, there's a lot of the other things that could be happening. A lot of times I even will look at mental health aspect too, because I'm sorry, when we talk about fatigue, when not sleeping well, maybe, our hair is thinning, maybe we are not exercising, not eating right, doing all those other things we should be doing. That could be the real culprit over a, endocrine abnormality like the thyroid. But the other thing I get commonly asked, which even my own nurse practitioners in my clinic, I'm giving them a shout out right now. They have asked me specifically to please ask you this question so we can record it and then play it in our exam rooms for patients who keep asking. But it's not thyroid related, but another commonly reported culprit for these vague symptoms of fatigue and all this stuff is cortisol. So I feel like, and I'm going to do air quotes here, cortisol level is the new quote lupus of endocrinology. And I can say that because we've had, one of our rheumatology experts talk about how lupus is always getting blamed for things, right? So patients often come in saying they have fatigue and the internet tells them, or just some influencer person, that this is related to their cortisol level. And they say it's adrenal fatigue. And then they ask me to draw a cortisol level. And then they're angry with me when I tell them that we really only check that for certain conditions or if you're in the ICU. So please tell us, what are your thoughts on this whole concept of adrenal fatigue and cortisol levels?
Oh, speaking of opening a can of worms, yes. So adrenal fatigue is absolutely not a true endocrine diagnosis. So none of the endocrine societies recognize it as such. The etiology of adrenal fatigue, sort of like, in like web folklore type is what I describe it, is cited as when you have chronic stress that leads to overstimulation of the adrenal glands, which in turn eventually results in their inability to meet the body's cortisol demands. There's absolute lack of scientific evidence that the adrenal glands, function this way without having a true pathologic diagnosis of Addison's disease, for example, or primary adrenal insufficiency. So when I have a patient that comes in with, then being diagnosed with adrenal fatigue, and I will also do the air quotes, we will often do a concentropin stimulation test, which is the gold standard for diagnosing adrenal insufficiency or Addison's disease. And their cortisol levels stimulate perfectly. All that to say that their body is able to ramp up cortisol production appropriately in response to a stressor without issue.
So what factors could affect if I just randomly drew a cortisol level on someone and it comes back as low on the lab value that, correlates to it? What information am I getting from this?
Well, I think a big thing that I see is that oftentimes cortisol levels are not drawn at the right time. So cortisol levels very much follow a circadian rhythm. And so the most meaningful cortisol level that you're going to check, if you're going to check one, is going to be an 8 a.m. cortisol. Because that's where cortisol levels peak. And those are, cortisol is a stress hormone. So our stress hormones go up in the early morning hours to prepare our body to wake up, assuming that you're not a night shift worker, et cetera, and that you sleep at night and are awake during the day. If you have had to have steroids for any reason, kind of in the recent past, that can absolutely lead to an artificially low cortisol level. And so there's also so much stuff that's happening right now where practitioners are checking cortisol levels like on a saliva sample, kind of like at various times of the day. Those results have never been validated. So they're so very hard to interpret. But lots of diagnoses that are being made on these tests that have never been validated. So really, again, in the endocrine world, the only time that we check a salivary cortisol is when we're actually looking for cortisol overproduction. So kind of the opposite of what we're talking about. And we will do a midnight salivary cortisol because, again, patients that are overproducing cortisol, they lose that circadian rhythm that I was describing, and their cortisol levels stay high, throughout the day. So again, lots of tests being done that have not been validated. And then in turn, diagnoses being made on results, of tests that really don't have good scientific evidence behind them.
And then this is another example. Again, I think we're talking about this every single time now, that predatory behavior that's out there too, where somebody's going to sell you something. And we talk about insurance companies all the time, right? I mean, there's some big hurdles with them. They really do make our lives a little bit harder in a lot of different ways. But the insurance companies are not all wrong in the fact that they don't cover a lot of this testing when it's done in the inappropriate setting. When somebody like Dr. Felton draws your cortisol level for, looking for Addison disease, something very specific, your insurance company is going to generally cover that test. When you're going to a different kind of practitioner who orders 10,000 tests, including the random cortisol level, your reverse T3, anything else under the sun, every progesterone, estrogen, and testosterone level that don't correlate to a certain day in your cycle either. So that's another hormone thing that they're just randomly checking that means nothing unless you can correlate it to a time. You're paying cash for these things. And you have to stop and think, why am I paying cash for these things? Is there a reason? Is there a reason my insurance company won't do it? Yes, we talk bad about the insurance companies, but this is an area where they're actually not covering it because there is no evidence that what those levels are doing in that setting are beneficial. We can get a whole lot of numbers and data, but if you don't know what to do with that data, it means absolutely nothing.
Absolutely. And I think we have all probably been the recipient of this. Poor patients that have paid hundreds, if not thousands of dollars for this testing, and then they come to their appointment with this stack full of papers with these results and want you to interpret them. And I have to have the difficult conversation of, I cannot interpret these tests because they were never meant to really diagnose anything. It was just the smattering, of things that were ordered across the board and done inappropriately. And of course, the patient is frustrated after, being out, again, the hundreds and thousands of dollars that they've spent on this testing.
Yeah, absolutely. And again, as we always say in these, it's not that we're blaming people. I mean, like I said earlier in this episode, I've been that person with fatigue, hair thinning, weight gain, and all of that, trying to look for answers. And when you're looking for answers, sometimes you get desperate. I look on TikTok a lot to research for these podcasts. And I think like every fifth video that I see is like, do you have cortisol face? And I'm like, oh my God, do I have cortisol face? Let me go look in the mirror. Like, you're not fat. You just have cortisol face. And I'm like, oh, well, maybe I need this so that I'm not so fluffy looking, so it's like, it's very easy to get sucked into it because they're very good at advertising and we want to look good, feel good, all of those things and look for answers. And sometimes, as we said before, that's the easiest place to get the information.
Yeah. And then when you're looking at them and they have this beautiful marketing campaign, their Instagram and their TikTok is just gorgeous. And they have nice, easy graphics and it just feels comforting when you look at it. And they themselves seem so calm and composed and happy with their life. And they tell you that they themselves have suffered from these conditions and found the fountain of youth and the cure. Then you think, well, I want that too. And it's not fair. I mean, again, being a postpartum mom, I'm sitting here, I'm like, I don't want to go to the gym 5 times a week and exercise. I don't want to eat right. I want to blame it on cortisol face. Just take a pill and make it right.
Yes, yeah, that's exactly. I think that is the hardest part, right? Is just people just feel frustrated with these symptoms. And like Jessica already mentioned, they don't feel heard. And then they come across something like this and they feel validated finally for the first time. And it makes them so susceptible to whatever is being sold, pushed, etc.
Yeah, absolutely. And I think that's when our job as a practitioner is important to, again, acknowledge, validate, not, gaslight or belittle people for trying to look for answers and, try to help them with the factual information that we have available to us.
Absolutely. One of the things we talk about a lot on here is that we have more training, education, and access to this information. So when we hear some of these things, we'll talk about some of the social media things, even in the second part of the segment, we think that's crazy talk. We think that's absolutely ridiculous and it makes us laugh. And we just kind of honestly brush it off and like, that's just so silly. But a patient is sitting there and they're actually relating to this and they feel heard and they feel like this is something they connect with. And so we have to take a moment to recognize that and then delve further into it and talk about all aspects of health. And I try really hard to bring up all components, like we said about the mental health component, the physical health, diet, exercise, all of the things, and then make sure there's not another medical issue. Oftentimes patients will come in and say it's their hormones and they all have diabetes. They're like, I have low blood sugar. They always say, I feel lightheaded and I don't feel good after I eat. I must need to eat more. And then we find out, no, you're hyperglycemic. It's complete opposite effect happening, but they've just been checking they don't even get their A1C checked. They're checking every other hormone under the sun and they result in this. But I know we could talk about this subject for literally hours.
and that's where the art of medicine comes in.
Yes,
so,
the art of medicine is still real.
Well phrased. Yes.
And again, you are a well-respected professor, physician on this matter, very reputable institution where you work. So, you are just somebody who are so thankful to delve right in and, break down these conversations with us in a way that hopefully patients and other providers can understand and relate to.
Oh, thank you. I appreciate that.
All right, Dr. Felton, I hope you're ready to play a game with us. So
I'm ready.
Congratulations on being our first contestant.
Your guinea pig. We'll see how this goes.
Exactly. On the second half of our show today, and this is a new segment, which I'm sure is going to become a fan favorite. It's called our Fact or Miss for Misinformation. We are going to tell you things we have read or heard on social media, particularly TikTok and Instagram, because that's what we usually utilize. And you get to tell us the truth based on your professional and very well-educated knowledge as a double board certified endocrinologist. And these will all be direct quotes, by the way, from social media. This could get us in a little bit of trouble for calling out some things, but this is misinformation that is out there, and sometimes it can be shocking. So let's go, and it's going to be fun.
Let's do this.
Okay, like I said, these are direct quotes. So make sure whoever's listening listens that this is a direct quote that we're quoting. Okay, this is not our information we're giving out. Listen to the whole thing. Don't shut it off after you listen to it.
Disclaimer right
there. So the first one we're going to talk about, whether this is fact or miss, again, like Cari said, misinformation, is this one. PCOS, polycystic ovarian syndrome, is a common hormonal imbalance that occurs when your ovaries create excess hormones. As a result, women often have irregular menstrual cycles and unpredictable ovulation. Since parasites can be a whole body issue, Certain parasites have a particular attraction for different areas of the body. Pinworms are known to reside in menstrual blood, and hookworms, which increase your susceptibility to PCOS. So, Dr. Felton, in your expert opinion on this game, is this fact or misinformation?
This is definitely a miss.
We don't have to break down every aspect of why this is completely crazy talk right here, but maybe pick like one or two things and just tell us why. Again, if a patient came to you and showed you, I researched this. And again, this is on the internet and not a small place at all. This is very, very big out there.
So let me first address the fact that there is a little bit of truth in what was read before we got to the miss. So, certainly women that suffer from PCOS or polycystic ovarian syndrome, they do produce excess hormones, specifically androgens. So testosterone and DHEA sulfate, which is an androgen that's produced by the adrenal glands. They do have irregular menstrual periods. These women are more likely to have hair growth in places that women don't want to have hair growth. They also have insulin resistance and are much more susceptible to prediabetes and diabetes as a result of that. So that part is indeed true. The second part of what you stated was absolutely new to me. I had never even heard this theory about the pinworms and the parasites. Certainly there has never been any evidence to support that whatsoever.
Perfect. Cold, hard, easy right there. This is the most nonsenseness. If you have pinworms, they don't live in your uterus. If you have hookworms, they don't live in your uterus. We poor people who are so concerned about this. And there's, of course, I want to put a thing out there with this certain one I read. She's selling you some cleansers and some parasite, things to get rid of them out of your body. Of course, you got to look for that. Where's that follow-up after that? Where this dewormer out there? Yeah. Where's your dewormer?
Yeah. Well, this was Jeopardy. We'd be awarding you 100 points.
Woo! Oh, yay.
All right. Number 2, there are tips and tricks to, quote, activating your T4 thyroid medication. Per this influencer, most everyone is on an inactive form of thyroid medication that is T4 based, which doesn't actually help you until it is activated in the body. And a huge percentage of people just can't activate it well. Your body halts the activation of T4 and halts the conversion of it to T3 on purpose when it wants you to go into recovery mode. So things that would put you into recovery mode, like stress from family dynamics and right into work and rush hour, it can cause a physiological stressor of inflammation. And all of this impacts the activation of your thyroid hormone medication.
It's a lot right there.
Yeah.
That was a lot. Again, a miss. Again, these are funny to me because, practicing endocrine all day, every day. I mean, some of this has not even ever darkened my doorstep, which I'm shocked by.
Just wait.
I know it's coming. It's coming. Absolutely. So again, just like what I did with the previous, let's talk about the stuff that's kind of, factual in what you read first. So again, T4 is the inactive form of thyroid hormone. That is actually true. And then we all have an enzyme called a deiodinase, which, plucks one of the iodines off of the T4 and converts it to T3. And T3 is the active form of thyroid hormone. T3 levels vary significantly throughout the day. So, really, in very traditional school of thought, we give you back T4 if your thyroid is not producing, enough thyroid hormone, and let this enzyme do its job so that you convert the T4 to T3 when you need it. Now, there are certain medications, chronic illnesses, etc., that can impact that conversion of the T4 to T3. So beta blockers, steroids, folks that suffer from chronic illnesses where we do see that from time to time. But certainly there is no influencer and there are certainly no tips or tricks that are going to really be able to help you activate your T4 to T3. So again, for the right folks that need that help with that conversion, they need to go see their primary care doctor. They need to speak with an endocrinologist, and we have ways to, to help with that piece if need be.
Absolutely.
I love it. Okay, on to number 3. This is, again, another good one, but I found this one online. There is a specific order in which to eat your food at mealtime that helps activate your thyroid. This would be starting each meal with a protein, then incorporating green leafy veggies, And then last, incorporate in carbs. Eating like this lowers your blood sugar levels and thereby will help your thyroid.
So again, a miss from a thyroid standpoint for sure. Now, again, I have no issues if a patient wants to eat that way. I mean, I take care of diabetes all day long.
That's great.
So,
please eat that way. That's great.
I'm like happy for folks to eat this way.
Which is probably why they feel better if they do eat this way, right? Is because it has
Absolutely.
so many other benefits that are not related to your thyroid.
That's exactly right. Absolutely. So no, I mean, from a blood sugar control standpoint, this would absolutely be helpful. There is no evidence that supports that any dietary changes are going to impact your thyroid. The thing I do want to touch upon here, because it comes up in clinic day after day, is that there is a significant amount of web folklore around going gluten-free, specifically in relationship to Hashimoto's. Again, there's no evidence that supports that. And it kind of goes back to what you just mentioned, Jessica, is that when patients do decide to go gluten-free, right, by the sheer nature of what that is, they're cutting out so much of the processed food in their diet. So they're having to eat more clean. They're having to eat more intentionally. They're eating the periphery of the grocery store that we'd like to preach anyway. And so of course they feel better, but that has probably very little to do with the gluten and Hashimoto's, but just because they've cleaned up their diet.
I love that. That's great. Again, we're happy if you want to do some of these helpful health benefit things. It just may not be rooted in the real cause of what you're talking about.
Absolutely.
You know? All right. For our last one on our game today, number 4, you can completely ruin your adrenal function with over-exercise. So in order to maintain healthy adrenal glands, walking, especially when fasting, is best.
Again, a miss. And really, I don't want to belabor this point, but I think this is very much touted in the same circles that adrenal fatigue is touted. And, we talked about that sort of earlier on. And so our adrenal glands are robust. So short of somebody that has Addison's disease, primary adrenal insufficiency, exercise is not going to overstress your adrenal glands to the point where they're not going to be able to function the way that we need them to.
Yeah, they're strong warriors.
Yes.
Yes, they are. Oh, they are very strong warriors.
Yes. It's great if you want to start walking. That's great. And if you want to walk when you're fasting, sure, that's fine too. Most people who exercise, I do first thing in the morning at 5 a.m, I'm fasting. So I don't know if that necessarily has a huge health benefit, but that's just what time we do it. But yeah, walking, that's great if you want to do that. But if you're somebody else who's exercising more vigorously, don't slow down because you're worried about your adrenal glands and you're going to pull back. That's not helpful. Or don't be afraid to go out and get your 150 minutes per week of cardio. Get some vigorous exercise in there if you can. If you've been approved to do those things by your doctor, go for it. Your adrenal glands, like you said, what did you say, strong warriors?
Yeah, the thyroid and the adrenal glands are strong warriors, unlike your digestive tract, which is a pampered princess. Any little thing will throw that off balance.
That's true.
The thyroid and adrenal glands, they're pretty sturdy.
Well, we found these examples way too easily to play this game. And these are not even the most extreme out there. And sadly, some of these are actually being told by some medical practitioners that with that, what Dr. Felton talked about, that web folklore. I really like that new term. We're going to start using that. So
we're going to make it trend.
We are. Hashtag web folklore.
Hashtag folklore.
That's why we brought Dr. Felton on, because she is actually somebody who can tell us about hormone health. And it's not someone who took some online training and quote, I do my air quotes again, online hormone health from a non-reputable organization. So how do you know who to trust? Where can you get the evidence-based information that you can rely on, Dr. Felton?
So specifically from a thyroid-related standpoint, there is a fantastic website. It's www.thyroid.org. This website is powered by the American Thyroid Association, so it has very credible information. There's information on this website, both for patients that have any concerns, as well as clinicians, who are trying to learn more. And it's all very evidence-based. As far as hearing medical information, again, from influencers, from social media platforms, I encourage my patients every single day. I'm like, please just write that stuff down. I mean, I am happy to go over that because, again, these are valid concerns, and I would much rather that they come with me come to me with those questions and I take the time to answer them versus, again, spending hundreds of dollars on supplements, et cetera, before they really have that chance to speak with me. And I know I speak for all of us that, I know that that's the message that you're delivering to your patients as well. So really, please utilize the resources that you have at hand and that you trust, primary care providers, endocrinologists, whoever that might be, to get real information before making decisions.
Yes. And the other resource is listening to the MedEdit podcast.
Oh, yes, of course.
And we don't ask for your money.
That's
it's all free.
Yes. Hashtag listen to the podcast. Dr. Felton, this was not only fun, but educational. And honestly, it was a little cathartic for those of us doctors who try so hard every day to fight back against rampant misinformation.
Yes. Thank you so much for being here. Your insight is truly invaluable.
Thank you guys so much for having me on today.
Don't forget, if you are a listener claiming CME credit, please look in the show notes for instructions.
And for all our listeners, thank you for tuning in. Please like, subscribe, and share this episode. Let us know what other topics you're interested in through our Instagram, and stay tuned for our next episode.